moments. 12:36 is the time. Today, of course, the 11th of September, marks the day 19 years ago that the 9/11 attack took place. The ceremony marking the event will take place later on today. Dr. Laurie Nadel is a disaster stress expert who helped first responders after 9/11 and also teens who lost parents in the Twin Towers. Thank you so much for coming on the program this morning, Doctor. Tell us about the kinds of first responders that you were talking to and some of the experiences that they had.
Well, I think the main thing that that struck everybody was it was a mega event. It was unprecedented, and here you had two of the world's tallest buildings that completely collapsed in the matter of minutes, and the smoke and the debris you could smell it, you could see it for over a year for hours, and the men and women who worked on the pile looking for remains, whenever they would find even a shard of human remains, they would stop, they would take up a formation on the pile, the bagpipes would play, and they would honor each particular shard that they had. The coroners who worked some of them had the very grim task of informing the family members. And years later, and this is, I think, what people forget, is that every year, the first responders who I continue to speak to, many of them say that it feels like something is around their neck, like a chain around their neck, and it gets heavier every year. People who don't think about it consciously at this time of year will suddenly be overcome with flashbacks and grief response, where they start crying wherever they are. So it lives with us.
I wonder to what extent the sort of attitude among firefighters in particular, but other emergency responders, and their sort of alpha maleness at times means that it's not a brilliant environment to have been in if you were struggling with what it is that those people had seen and had to do.
Well, what I've been experiencing over the years is that people start talking about it sometimes years after the event. I know in my program for teenagers, there were young men in the program who wouldn't even talk about what happened until 2 to 3 years after the event itself. And so it's not so, there is a movement, a global movement actually, among first responders and especially firefighters, to have debriefings, which are safe kind of dialoguing sessions where people are encouraged to talk about exactly what they're sensing and feeling, because it's human. The emphasis is it's human to have strong emotions, and it's human to be disturbed when you're at a mass casualty event. Doesn't mean that you're not strong, and it doesn't mean that you're not professional.
You talk about the sort of latent response that there might be in some people having gone through a trauma of this kind, and that something at some stage in their life triggers a massive response, massive emotional response, and also the memory of that. Can I ask you about somatic memories, about the ability the body or the mind has, to bury traumatic memories for them only to be released at a later date by something that happens?
It's an excellent question. All of our emotions are stored as molecules in a part of the brain that's actually connected to all the organs in the body. And when we have to survive, when we've been through something tragic or catastrophic, we have to make survival decisions, and we're flooded with stress hormones, we tend to take those feelings and we shove them in a drawer so that we can cope. And the thing is, we have no control over when the drawer is going to fly open, and the body will be flooded with those same molecules as if we were reliving it again. And this is happening to many first responders in COVID, because the expanded sense of helplessness and hopelessness, and in the case of COVID, it's a disaster of uncertainty because we have no timeline. In the case of the towers or Grenfell fire, it had a beginning, a middle, and an end, and a long psychological aftermath. But now we're living in, we don't know if it's the beginning, the middle, the end. It's not even uncertainty, it's really unpredictability and instability. And that's bringing up a lot of these old molecule responses, the somatic responses.
What I find astonishing about this, and we've talked about this before on the program, because my wife is training to be a psychotherapist at the moment, and she's reading about all this stuff, and I sort of picking up via osmosis, as it were, is the sort of physical nature of trauma is literal. So as you say, that it is, your memories are physical.
Yes, trauma is it's physical. It's in the body. One of my colleagues said that when we have a flashback, it's as though the body is trying to regurgitate the unpleasant or the really tragic emotions, and we'll end up feeling that we are reliving it again, or we may have knots in our stomach, or we may actually, have a physical response that involves, vomiting or crying or something very extreme, because the brain is attempting to flush it out of the system.
And how can that flushing out of the system be encouraged?
Well, I think the most important thing that we found over the years is finding a safe space to talk about it. And within the first responder community, that means peer sessions where people are talking about what happened with others who have been through similar or the same experience, the same event or something similar. I have a group for first responders on Zoom. We are starting to meet once a week, and I think that that gives people a safe place to talk about these sudden, unexpected kind of reissuing of somatic experiences.
I could talk to you for a very, very long time, and I realise that we're running out of time. But is it therefore possible that an event so traumatic that the body buries it, or the molecules stay in that part of the brain, that you clearly don't know about because it's not been triggered, and so therefore the idea of the human experience or human memory is completely altered because something can happen to you in your life that you have no memory of and no understanding of and never have?
I'd like to use a basic metaphor that the psyche is like an iceberg, and the tip of the psyche that we think of, this is us, is like the tip of the iceberg that sticks up above the water. But everything is stored in the unconscious, and so we have unconscious memory, and it does affect us even if we're not completely aware of what it is. It doesn't go anywhere.
Dr. Laurie Nadel, great to talk to you. Thank you so much for your time. Disaster stress expert who helped the first responders.
Laurie, thank you so much. That was
Thank
just
you.
what we were looking for. It's perfect. Look, take care. Have a good evening. Have a good day tomorrow. Thanks for coming on to talk to us about a really, tough topic, and especially in the midst of what's going on. And I'm sure we'll speak to you again soon. All the best. Thank you.
Thank you so
the
much.
idea of
Take care. Thanks. Bye.